Hello, it's Dr. Edward, the Healing Vet here with your weekly holistic pet health show here on streaming live to Facebook and to YouTube and all over the internet. So I'd love to hear from you. If you want to have any questions, ask them in the comments. I'll get back to you. But today we're going to talk a little bit about safe and natural pain relief alternatives for your pets. So pain is a big problem in pets. It's something that nobody wants to have their animal suffer pain. And pain relief is really, really important, especially after surgery, after injuries. And if you've got an older animal that's got arthritis or problems like that are painful, it's important to make sure that they're as comfortable as you can make them in a safe way. But the thing is that in general, the veterinary industry, if you take an animal in that has pain, you're going to get a prescription medicine. And it's by far most likely going to be a non-steroidal anti-inflammatory drug. Most vets just prescribe these things willy-nilly with little or no concerns about the harm that these drugs could do to the animals that they're giving them to. Because in most cases, these drugs are relatively safe. But sometimes they can cause severe harm, and animals have died from these prescription drugs, particularly non-steroidal anti-inflammatories. So let's talk a little bit about the different range of prescription drugs that veterinarians will tend to use for animals that have pain issues. The most commonly prescribed family of drugs for pain relief, as I said, especially for chronic pain, are going to be non-steroidal anti-inflammatories, NSAIDs. The most popular one, probably in the veterinary industry, is meloxicam. Other brand names that can be used are Carpreve and Previcox and Galliprant, Carprofen, Rimadyl, Deramax, and there are others. Aspirin, too, is a non-steroidal. Now, aspirin is different than those other drugs in that aspirin is derived originally from salicylic acid from the bark of the willow tree. The other ones are all entirely synthetic chemicals. Now, NSAIDs can cause a range of side effects in the body. The most common sort of problem that you get with NSAIDs is gastric upset. So you'll see dogs with vomiting, with diarrhea, with bloody diarrhea, or with black tarry poos, or going off their food. And the black tarry poos are a sign of bleeding inside. So the non-steroidal anti-inflammatories cause damage to the gut wall. You can get ulceration and bleeding. Now, even if you don't get these symptoms, if you do have an animal on these drugs and you do get those symptoms, you should stop giving that drug immediately and go back to the vet, or maybe come and talk to a holistic veterinarian and perhaps try some of the alternative natural treatments that I'm going to talk about in a minute. The thing about the gastrointestinal side effects is that even when there's no overt symptoms, you do get a lot of leaky gut issues from giving animals non-steroidal anti-inflammatories. So you should avoid them unless they're really, really needed. Last resort in case of everything else that I'm going to mention later on in this show not working. NSAIDs can also damage the liver and kidneys. So other signs to look for in terms of side effects and red flags for maybe stopping using the drug with an animal are behavioural changes, skin redness or scabs, and drinking or urinating excessively. Now, if you're unlucky enough to have one of the small cohort of animals that are more sensitive to NSAIDs and do get damage from them, if you have liver or kidney damage, happen, that's not so easy to fix, especially if the kidneys are damaged. Once you lose kidney function, the body can compensate to a certain degree, but after you get past a certain amount, you're done. There's nothing more you can do except have a kidney transplant or dialysis, which honestly is not an option for animals anyway. There's a lot of human non-steroidal anti-inflammatory drugs. Don't ever give those to your pets. I've heard some absolute horror stories from people doing that. It's absolutely not recommended. Now, non-steroidal anti-inflammatory drugs do have their place, but for me they're a last resort. And they can be great for palliative care for older animals that are having severe pain and trouble that they need help with. And in my career, especially earlier days before I moved into the more holistic field, I had a lot of old dogs that were on non-steroidal anti-inflammatories for a long time and did really well. But it's like Russian roulette. You just don't know if your dog is going to be one of the unlucky ones, which is why now, with my greater holistic knowledge of all this stuff, I will not use these unless it is a last resort and palliation is needed for quality of life to relieve pain. If you do have an animal on any of these drugs long term, you should have regular 3-monthly or at least 6-monthly blood tests to check liver and kidney function. There's other classes of drugs that veterinarians will prescribe for pain relief. Another important group of drugs is opiates. Now, opiates are tricky because they're sought after by addicts, heroin addicts, opiate addicts. So generally, they're going to only be used in a controlled environment of the vet hospital in terms of drugs like morphine, fentanyl, and these opiate drugs can be tremendously useful for pain relief during and after surgery, short-term after surgery, for instance. One opiate that can be used for chronic treatment of pets is called tramadol or Tramol, and this is really good for some animals and completely doesn't help other animals at all. It's a strange drug in that there seems to be a variable response to it. All opiates can cause sleepiness and constipation. Some dogs, if you give them Tramol, they just become like dozed out zombies, and it's not viable to keep them on it because it affects their mental emotional state too much. Some other drugs that are used, particularly in older animals, are gabapentin. Neurontin is another name for that in terms of when you look at the brand names, which is more for neuropathic and neural pain in humans, but it does seem to help older arthritic animals quite a bit in some cases. Not in all cases, in some cases it does nothing. And another drug that's sometimes used to treat arthritis in older pets is amantadine. Now, when you get to that real end-of-life palliation thing, you're going to have dogs that will be on multiple prescription drugs sometimes, in addition to all the natural options that I'm going to be telling you about next, because you should try all the natural options first. Absolutely should not be using prescription drugs unless you really, really, really need to. And as an aside, don't ever give a cat Panadol. You will kill it dead, and it's a slow and horrible death. So let's talk a little bit about natural pain relief options. And I believe that you should explore and try all of these and see how much relief you get from them before you consider using prescription drugs. So CBD, cannabis extract, whole plant, CBD rich, very low in THC extracts are safe, highly effective, powerful anti-inflammatory pain relief herbal medicine. I have had a lot of clients use CBD for pain relief, particularly in arthritis, and seeing really consistently good results in most animals. Doesn't work for every animal, but it is really, really good. Indivita here in Australia, and Charlotte's Web, which is in America and other places, are great brands. Or if in the UK, the Spirit of Hemp is another really good brand for CBD-rich whole plant extracts. Essential fatty acids, omegas. Now, there's some fairly recent research that shows that at high dose rates, about 3 times the recommended sort of supplement dose, essential fatty acids can be as effective as NSAIDs for pain relief. I recommend getting calamari oil if you're in the States, or you can order and have it shipped to you from Dr. Tobias in Canada. He has a really good high quality calamari oil supplement. And if you can't get that, just look for the best quality one you can and give it at high doses if you want pain relief. Another really good herbal medicine is turmeric. So you can make golden paste, and in the companion blog post of this is a link through to a recipe that you can make for yourself, where you mix the turmeric up with coconut oil and water and a bit of pepper and perhaps ginger. It's another potent herbal anti-inflammatory that can be really, really helpful. Green-lipped mussel extract is a supplement that I give to every older animal that I see with arthritis, and it often has a really obvious positive impact on these animals in terms of them being able to move better, to feel more comfortable, to be happier. Another thing that's really simple, and a thing that a lot of people forget about, is that if you have a dog that is overweight, then putting them on a really strict diet, knocking the weight off them, getting them ribby and lean is actually one of the most effective pain relief measures that you can possibly use when it comes to this pain relief, because if animals that are old and arthritic and have joint pain are carrying any extra weight whatsoever, this is bad for them. Really, really not a good idea to have any extra weight on older dogs that have any kind of pain issues. You want to have them lean. Now, you're going to need to be emotionally strong if you're going to put your dog on a diet, particularly if they're a bit chubby, because they're going to you have to let your dog be hungry to get lean. And a lot of dogs don't like being hungry. They've never been hungry in their life. And they look at you as if they're going to die. But honestly, it's a really, really good thing to give your animals a diet, leanness, getting the body weight off. Heat packs are another really affordable, effective way to ease aches and pains in older pets. You can get the wheat packs and heat them up in the microwave, and then pop them on the dog along the spine. All that sort of thing can be really, really, really helpful. And you can just test it on your face to make sure it's not too hot, which is also important. Just had someone in the comments saying they've been giving their dog Rosehip Vital for pain relief for arthritis and aches and pains, and it's been really good. And that's one that I had forgotten to mention, but it is absolutely a really, really good product. Again, you'll often see animals show really big improvements on that supplement. Body work, hands-on work, can make a massive difference in the quality of life and relieve pain very effectively, particularly neurofascial pain, soft tissue pain, which is often missed. So silent pain is a huge issue in our animals, and it's something I'm super passionate about, because I've worked out that more than half the animals that I see have pain that the humans don't even know is there. And the only way you can find that pain is to feel into the body and assess for it hands-on. I have created a healing bodywork modality for pets, the whole energy body balance method, and we have online trainings where you can learn how to assess for pain in your pet's body and how to melt it away with loving touch. And again, that is in the links that you'll see in the companion blog post. Acupuncture and acupressure can help a lot as well with animals with pain, and hydrotherapy can be a great option. So if you've explored all the natural options, and often you're going to be using a whole lot of things together. It'll be a multifaceted approach to pain relief for the animals. But you're going to get to a point in the lives of most older animals when the pain in their body from their arthritis and wear and tear and becoming ancient is going to become too strong for the natural products to deal with. And that's when you're going to want to consider rolling in prescription drugs, especially for older animals with severe chronic pain, because at some point quality of life becomes more important than the potential harm and side effects from prescription drugs. That being said, another time that you have pain relief with your animals is after surgery. And you can consider replacing what would normally be used in the vet clinic with high-dose essential fatty acids, because there's research proving that they're quite effective. Short-term opiate therapy is pretty safe. And if you are using CBD too, it's really important to avoid giving your dog CBD for 3 days before and after surgery, because CBD is a mild blood thinner and it can cause excess bleeding if the animals have that active in their system during and after surgery while they're healing. So, and we can't escape pain, right? Every animal is going to experience pain in their life, and the body's going to become more uncomfortable as it ages and breaks down and wear and tear builds up. But there's a lot you can do. I really encourage you to be very proactive about getting onto a pain relief, a natural pain relief program as early as you can. Don't wait until the animals are really rickety and stiff and sore. Start early, because the earlier you start, the less the pain will build up in the body, and the slower the pain will build up in the body, and you'll have a much happier, longer life for your animals when you take that proactive approach to doing this. Okay, thank you so much for being here on our weekly holistic pet health show at The Healing Vet here on YouTube and Facebook. If you ever have any questions, you want to contact me, if you want to learn more about our online trainings in the whole energy body balance method, or if you want to have holistic veterinary consults with me, please reach out. I'd love to help you help your pets have the best life possible. Thanks so much for now, and goodbye.